See if it's working. Hey, I don't know how that happened. Oh, hey, everyone. Welcome to Say It's Sunday. It's good evening, not to good morning or good afternoon. Good evening, everyone. I'm Angela McGowan, your professional healthcare advocate and caregiver strategist, and I'm the author, publisher of this book. What you don't know could kill you, how to get out of the hospital alive. And so I'm also the founder of Angie's Pace. As patient advocates committed to excellence, good Sunday evening to everyone. And as everyone knows, there's two things we're going to take care of right away. And that's thank you. Thank you, caregivers. Thank you. It is Caregiver Sunday. Thank you, caregivers. Thank you for being just awesome. You are always giving, sharing, making sure that the life and the means necessary to have a healthy life as possible are always in place. Thank you for your tireless service. Thank you for putting yourself on the back burner so that someone else could be taken care of. And as I always say, I want to remind you that it is good that you're doing that, but we need to schedule time that the caregiver can flourish and replenish as well. That is why we always need to have in place the family care plan. So that the main caregiver, if it's not one that is employed, the main caregiver can see and take care of themselves as well. We want to make sure that's done. But other than that, you're absolutely irreplaceable. And if no one said those two words to you this week, it's my honor to do so. And I want to say thank you. Thank you very, very much to each and every caregiver that is out there. All right, so let's talk about CMS today on Say It's Sunday. Uh, so who is really in charge of the three public health insurances: Medicare, Medicaid, and MediCal? Let me just say, I probably may not refer directly to MediCal very often because it is really Medicaid in California. So if I say something, there's a ruling about Medicaid, it includes MediCal. But because of the way California, that's why it's called CMS, the Centers for Medicare and Medicaid. California got in there. It is also MediCal. So who's running it? I guess I gave that away already when I was explaining. It is the CMS, Centers for Medicare and Medicaid Services. That's the name of it, Medicare and Medicaid Services. So what does the CMS have to deal with? I'm going to give you a little insight on that. First of all, over 58 million of Americans are on Medicare. All right, we talked about this vast number worldwide because some of the people live in other places. But listen, when we're talking about the distribution of those new Medicare cards, so let me just put a pin in it, as one of my pastors used to say, put a pin in that. Please, if it is past May 1st, you should definitely have a new Medicare card, okay? Social Security office, CMS, no government agency is going to call you about giving you a new Medicare card, validating your information about your birthday, your social. No one's going to call you, okay? And there is no purchase price. I think that's important to know because there are several scams out there. They are calling especially older Americans who would be over 65 on Medicare, saying that there's fraudulent activity with your social security number, something on with Medicare. Please call this number. Listen, what I want you to think about this one thing. I've gotten several of those calls, and this is a new phone. I think 5 people have my phone number. But this is what was amazing. When I listened to the messages, it was the same voice with different messages. That woman called me with 4 different messages. One about my social security card, one about some other fraudulent activity, once that someone was coming to serve me some papers at my job or place of business, and once about they were in my neighborhood, wanting to give an appraisal of my house for a refinance mortgage. The same voice. Yeah, it's pretty amazing. So listen, if you have Medicare, no one's calling to verify it from any of the government agencies. Next, Medicaid. Over 75 million of Americans are on Medicaid. 1 out of 5 people in the United States are on Medicaid. Not 1 out of 10, 1 out of 5. 75 million. That's 25, well, not 20, a little less than 20 million more on Medicaid than on Medicare. And our breakup insurance company, MediCal, 13.3 million, and I put Americans, should have been Californians, on MediCal. That's over 1/3 of the California's population. 1/3 of the people that live, over 1/3, but 1/3 of people that live in California, we will find them on MediCal, which is also called Medicaid. So let's talk a little bit about this CMS, the Centers for Medicare and Medicaid Services. They're part of the Department of Health and Human Services, right? And CMS, that part, oversees many federal healthcare programs because Medicare, Medicaid, and MediCal, all federal healthcare programs, all right? And including programs that we might not hear about that involve health information technology. And the meaningful incentive program. What does all that mean? Well, it means the technology is the electronic health record, EHR, or as it first came out was the EMR, electronic medical record. Either one, M or H, it's the same thing. Okay. And they talk about the how data is being passed around from your insurance company to your doctor's office. And now you will probably notice several companies have what they call a membership portal. I don't know where the sun's coming from. I thought I blocked it. Obviously, I'll have to work on it. Anyway, this information is being passed around because sometimes you can go to the doctor, you might need a test or whatever. And when the authorization comes through, this is not something you would see as a patient, but in the doctor's office, they have to have, sometimes it's a nurse review, and sometimes it's what they call a peer-to-peer review. That doctor has to talk to a doctor that is in the Department of Quality Control and Authorizations and find out exactly what did the doctor say, and there's questions peer-to-peer, the doctors ask and answer each other to see if this is something that should be done or is there another way. That other doctor might say, well, have you thought of, have you tried, have you suggested? Because the notes that they have don't make it crystal clear. Sometimes there's an RN to RN review, and that is when the nurse of the doctor's practice or his nurse practitioner or his physician assistant would talk to an RN because they are not, none of those are doctors, and they would talk and they would do a review on the same things, but not necessarily having to bring the doctor in. If the doctor gets on the line, he's or she would be talking to another doctor. So how did the CMS start? What's the history of that? So after Medicare and Medicaid were established in 1965, the Social Security Administration, which was attached to the Department of Education and Welfare, these huge departments, right? They administered these federal health programs. That's Department of Health and Education and Welfare put the programs together. And afterward, the Social Security Office, operating under them, came up with the CMS because just Social Security itself, if you're on Social Security, anything to do with them, it's a lot to deal with them as well. So the health programs we went over already are Medicare, Medicaid, and MediCal. So in addition to Medicare and Medicaid, the CMS also administers a couple of more programs. One is called CHIP, Children's Health Insurance Program. What is that for? Depending on your income, why wouldn't they involve under Medicaid or MediCal? Well, sometimes there are two-parent households. Maybe one parent has an insurance for them, another one may have a more limited, but whatever it is, their income together cannot afford to give the children insurance. Or maybe they're working jobs where there is no insurance for anyone. But Medicaid may feel you can do it, but we're going to do it for your children. That is where CHIPS come in. It makes sure that from infancy, I believe it's until 14, the children see vision, dental, well checks. And if there's anything that they would need to be hospitalized for, CHIPS would take care of it, not Medicaid. Okay, CHIPS would take care of it. The children have their own insurance. And the next thing that CMS is also responsible for is the Health Insurance Portability and Accountability Act, which you know as HIPAA. That's right, HIPAA. I always wanted to spell it HIPPA. I got it together. All right. And they have portions to do what they call the macro law. These two are under the macro law. So that's a merit-based incentive payment system. Okay. So if you're a physician signed up for a CHIP, then based on what you are doing for those particular members, you get incentive-based pay. So we want, the children need to get all the well checks, make sure they're having their shots, make sure that they are school ready. If there's anything wrong with them, health-wise, dental-wise, hearing, vision, then that needs to be addressed and you need to take care of them. As I said last week, there is an epidemic of the measles. The measles are back. When it was documented by the CDC, they had been eradicated, but they are back. And so now CHIPS and all other pediatricians have been mandated that beginning at 6 months old, that measles vaccinations have to begin to take place. And when they check, when they call, if you refuse, then you can pay a citation, a fine for that. That's how bad the epidemic has become. Your child will point blank not get in school without that measles epidemic booster. Well, not epidemic, measles booster. We don't call it epidemic booster. Okay. All right. And then on top of it, let me show you about this payment system. I think it's very important you understand what's going on with your doctor, because I've told you. This is prepaid medical, people. So when anything is happening, you need to make sure you are informed and you need to make sure that you get your questions answered. So there are bundles that are paid for physicians and health organizations that take care of the child from infancy all the way up and make sure that all of these steps are done. So when they turn their records in, there's incentives, extra bonuses that are paid to these physicians who not only cared for the child, but have made sure that the child is able to go to school ready, without contracting any of these diseases that they are currently fighting. So since the passage of HIPAA and the Clinical Act, okay, CMS has been charged with running, okay, this incentive program to the tune of $30 billion of funds to be paid out to healthcare providers. $30 billion. That's a lot. So when you're going to the doctor with your children, for yourself, with your parents, Medicare, or if it's Medicaid, or if it's MediCal, everybody's getting paid. So you need to make sure that you are getting serviced. They're getting paid. Can we please get service? So when the healthcare providers successfully submit, because everything's done through technology, all of these claims or encounter forms that show what they have done, they get reimbursed. Okay, so this whole coding system, ICD-10 now, I believe it was ICD-9 for tons of years, all of that goes. So that's what's going on with your health care. So let's talk about Medicare, that has, do we say 58 million people on it. So what is original Medicare Part A covers? Do you know? I hope you do, especially if you're on Medicare. If you're not on Medicare, your parents, grandparents, there's things you need to know about Medicare. Medicare has Part A and Part B. Part B is considered the doctor's services. When you go to the doctor for your well checks, if you have something acutely wrong with you, some type of allergy or anything else may go on, anything that can be done in the doctor's office is billed, taken care of by Part B, I'm sorry. Part A is everywhere else, such that is inpatient. For instance, inpatient care in the hospital, that comes under Part A. Skilled nursing, rehab, or places that you may go after leaving the hospital, that would be paid, taken care of under Medicare Part A. If you have home health services, that's done under Medicare Part A. If you have hospice care, whether you're in a hospice facility or at home, that too is done under Medicare Part A. So there's two ways to find out if Medicare covers what you need. So how do you find out? Okay, a great way to find out if you're covered or if you're not covered, should definitely say, is to talk to your doctor or any healthcare provider, okay, about the services, the supplies, if Medicare covers them. All right, you usually don't have to worry about that because Medicare providers tell you upfront usually what they have, and if there's things that they say, I don't think Medicare will provide for you, what happens? Well, you get a form to read, and it's like a notice, and you have to sign it that says that if Medicare does not come through when the claim is submitted, you will be liable financially. You can also find out from Medicare itself by going to www.medicare.gov or www.cms.gov. So you can find out for yourself in case you get some information and it doesn't sound like it should be that way. Okay, so Medicare coverage is based on three main factors. I thought I had that up here. Okay, so on three main factors, here it is. Federal and state laws, they're the regulators. So think of it, you have CMS that oversees Medicare and Medicaid, but those are still federal programs. So the federally, they give out this lump sum of money. Then by state, there's some that say make regulations. This is where these other smaller programs come from, like CHIPS for your children. Okay, they're making smaller programs. And then in the county might say, we will facilitate, we will handle this population, we will handle that population. And then they get some of the money. So it just continues to trickle down. Everybody gets some of the money. But what we want to ensure is that while everybody's getting paid, that you are getting service. What good does it do for you to make for them? Well, it's not for you, for them to get paid and you don't get the service. It's not working. So that's how it goes. So national coverage decisions are made by Medicare. What does that mean? That means wherever you go, they say you can get a well check. And that is, Medicare does that once a year. Everybody has Medicare. That's a national situation. Now, local coverage decisions are made by companies in each state that process Medicare claims. Okay, so your insurance companies that process these claims, all right, they pay the physicians, hospitals, and then they send their own claims to the federal Medicare, and then they get reimbursed. So these companies on your local coverage, they're the ones who say what's medically necessary and what should be covered in their area, because based on who is going to the doctor there, they have a huge population of women. They probably have more women programs, a huge population of children, if they have a lot of veterans there, or there's a lot of drug situations, this is how they formulate and mandate and decide about programs being implemented. You might go to one state and there's a lot of programs for children just easily available. You may go to another state and it's only in certain areas. You might have to drive further for this. Okay. Now we're talking about what if you're not covered? How can you find out? The advanced beneficiary notice of non-coverage. That's what your doctor is going to give you, or the hospital will give you when you are there and you say, this is something, a test that you want. Someone will come from, I call it admitting, that's not registered, from admitting and say, this is not covered. You need to sign to say that if, for whatever reason, after the doctor does the test, it shows it wasn't a medical necessity, to know that you're going to have to pay. Okay. So if you have original Medicare, you can find out if that's yourself. You can verify. Your doctor, healthcare provider, or the admitting office is going to come and let you know definitely. All right. So the ABN, which is advanced beneficiary notice, it's not a denial, but it does list services that right now they say are not going to be covered. So when you go in, you know what you're going to be covered, what's going to be covered and what's not. And so they lay it out, the financial responsibility, they lay that out in advance. But there are sometimes when you're in the hospital, something else might develop, something that they didn't know, something you didn't sign for. Depending on the medical necessity, okay, will depend whether you get it there or they say, we're going to let you out and you go have an appointment. I tell you, do not leave. Have it brought to the bedside. Have the doctor come to the bedside. There's several options that you could do regardless of this. If you want these services and they say they're going to be paid for Medicare, when you get out, you can appeal it. Because many times after the results are out, even though they said they didn't think you would need it, depending on the diagnosis, it says maybe these other things didn't add up, but it's clear this is the diagnosis. Okay, so that's like an automatic appeal. If you want services, items that are not paid for by Medicare, but you don't want your provider to bill Medicare, then you can put your credit card down and just say, well, just here it is. Okay. And then option 3 is you don't want the items or services they say are not going to be paid for, and you don't want to be responsible for the payment. So a claim is not submitted. If they don't submit a claim, you can't file an appeal. But here's a 4th one that they don't list. And let me tell you, if for some reason Medicare doesn't cover it and there's something more wrong with you, you can call the social worker, the case manager, inpatient, and they can help you apply and move from just Medicare to Medi-Medi. So that would be Medicare, Medicaid in the other 49 states, and California, Medicare, MediCal. And you can get based on the information, the diagnosis, and everything else, and you can become part of Medi-Medi. So whatever Medicare doesn't pay, Medicaid will reimburse and do that. So those are some important things that you need to know. It's the same thing in a skilled nursing facility. Under Medicare, skilled nursing, you have 100 days. 100 days, whether you take 30 here, 10 here, it's 100 days. After that 100 days, then they want to know about your finances. They're going to know about your Social Security check. Okay? Social Security is going to, then Social Security steps back in here. They want to know about retirement. They're going to want to know about your financial ability to pay on the 101st day. And let me tell you, they're not going to wait till the 100th day to ask you. Around the 60th, 70th day, if they think you're going to be there a little while longer, they're going to start talking about that money right then. All right. So you're going to know about that. And there are, unfortunately, times when you could be in the hospital about to have a procedure or a test. And it's like you will get someone come from admitting and say, inpatient non-coverage, because something has gone, even though they had checked, you had a clearance. Once you got in there, they run another check before anything happens. And then they found that you are not eligible for all that you thought you were going to have. And you have to make a decision based on those options, Will you leave the hospital until you can get it fixed? Will you put your card down, your credit card, or will you make an appeal, which means you still are going to leave the hospital unless someone, a case manager, caseworker, or maybe even your doctor's office goes and calls to verify and says, this is what we need. It is urgent. And all of those are done for you. So listen, I know it's Sunday. I know that was a lot of information, but it certainly is important information because so much is going on in the healthcare system. And I always say to you that excellent healthcare is not a privilege, it's your right. Exercise your rights and handle your healthcare responsibility. And always I'd love for you to come and visit my website, see all the things that Angie's Pace is doing. There's 2 ways you can get on. And if you have questions about what you've heard today or anytime, any broadcast, I'd love to speak with you. Why don't you schedule a 20-minute free results call with me at the Bitly link? And that is at Advocate Angie. And then here's something I definitely want you to spread the word about, and that is on next Saturday. I'm having a free workshop, and it is entitled Medically Parenting Your Parents Workshop. I think I said mom and dad, but anyway, are you prepared to medically parent your parents, your mom and dad? That's a big deal. Here's how you can register: bit.ly/med-parent. And of course, you can go on Angie's Pace as well. Listen, there are a lot of things going on. As you can just hear right now, your parents, your grandparents, if they have Medicare, Medicaid, or MediCal, there's a lot of things if you knew in advance. Like, they don't have to be sick, nothing wrong with it. But if you knew in advance what to prepare for, what information you would need, but when something occurs, not nothing catastrophic, but when something occurs and they have to be helped from outpatient to inpatient and maybe even having to stay in a skilled care facility, you're going to be ready. Listen, the fastest growing population of people that need to be ready to medically parent their mom and dad are 25 to 40-year-olds. 25 to 40. Those that are just getting out of college, those that are just establishing themselves, those that are still raising young children, they are the ones who are now having a lot because maybe they're the baby. Maybe the other siblings are older, maybe they have medical challenges, or maybe they live in other states. But this is a growing population of adult children that have to medically parent their mom and dad. This is a workshop, August 10th, that's next Saturday, 9 a.m. Pacific Standard Time, 10 Mountain, 11 Central, 12 Eastern. I'd love for you to join me. As I said, it's absolutely free. Tell someone about it. Okay, so this is Angela McGowan, your professional healthcare advocate, caregiver strategist. I help you navigate through healthcare's sea of red tape, and I create strategies that allow you to give excellent care to those that you love and care for as you care for yourself as well. And always when I leave you with what? Those 2 things: blessings and joy. Why is that? Because they both belong to you. Have an excellent week. It's Sunday. We started our week off fantastic. Let's continue. I will be with you tomorrow, 9:05 a.m. Pacific Standard Time. So I'll be back at the 9 o'clock slot. And we will be, of course, talking about things for adult children. We'll be talking about getting ready for the workshop. And we might even have something else to say about Medicare. Don't miss it. All right. Next Sunday, we're going to be doing even more on Medicaid. And I don't know if we're going to give MediCal a whole Sunday, but we just might. But we're going to get this information out because it is useful and you all need it. We all need it. I'm learning a lot. Okay. Thank you. It's Angela McGowan. Take care. Blessings. Bye.